Hello everyone, welcome to my channel Ravi Static Physio. So in the series of medical physiotherapy laws and ethics, so next topic is principle of biomedical ethics. So what is the biomedical ethics into the physiotherapy? So let's understand about that. Ethics are the personal code of conduct based on the respect of oneself and other and surrounding, and is governed by the principle of assumption underpinning the way of individual of organization or the conduct themselves. So there is a principle for conducting any hospital or any like a multi-specialty hospital, so super specialty hospital, any nursing homes, any clinics. So have to be some procedure to regulate their hospital or clinics. There is a some principle, some rule and regulation, and there is a code of conduct defining responsibilities of the practicing physician to make decision and patient care of different settings. This decision involves more than selective the appropriate treatment and intervention. So there is a treatment protocol with different patient and different have to be implement on the patient, have to be different mindset. So you have to learn about the different settings of the treatment procedure and appropriate treatment planning over the patient after the diagnosis. So there is a fundamental principle of biomedical is to be there is some condition or some important things before the starting the treatment procedure. These things has keep in your mind as a therapist or as a doctor. So first is beneficence. It is the obligation of the physician to act for the benefit of the patient and support the number of moral rules to protect the defend the right of the other, prevent harm, removes condition that will cause harm, help person with disability, and rescue the person under danger. So you have to provide any treatment procedure towards the patient after the diagnosis before providing any kind of harm. So you have to be treated in a beneficial manner. Either there is gender biasness, not think about that. Either it will cast not do the gender biasness, not do the caste biasness, or also into the religion biasness. The principle calls for not just avoiding harm but also the benefit of the patient, and to promote their welfare, and the goal of providing benefits can be applied both individual patient and to the goods of the society and the whole. So example, the good health of the particular patient is an appropriate goal of medicine, that is a prevention of the disease through research, and the employment of vaccines is the same goal expand to the population at large. So you have to be providing such treatment protocol after the diagnosis. So you have to provide in your treatment procedure in a good manner, so the patient have to be uh, told us other society members. So there is a doctors to be good treatment procedure, and they have a big knowledge and experience for regarding to any disease, regarding any medicine, or else also the treatment procedure. So also you have to be keep these thing new intervention, case based studies, and recent new launch medicines, and also the case based studies. So you have to be learn about different and every days. Second is to be non-maleficence, the obligation of the physician not to harm the patient. These simplify the state principles, support several moral rules: do not kill, do not cause pain or suffering, do not incapacitate, do not cause the offense, and do not deprive others goods of the life. So you have to provide such treatment procedure during the patient diagnosis. So you have to not think about that either it will gender biasness, either it will be like a caste and religion biasness. You have to provide treatment without any pain, without any kill. You have to be some moral rules towards the patient. And also if patient have to be very poor, so you have to be very few amount, you have to be treatment give and support to them. And also in case of any respires, so you have to be provide such quality of life as you can have to provide that. The principle of affairs affirms the need for the medical competence. It is a clear that medical mistakes may occur. However, the principle articulates the fundamental commitment on the part of the healthcare professional to protect their patient from the harm. So any kind of potential harm and contraindication, keep this thing in your mind, and ask the patient for alternative option, either the manipulative option, either it will be the electrotherapy gadgets. You have to be share such information towards the patient, and patient have to be right, either it will be choose and there will be deny. And if there is any kind of potential harm, it will be occur on the patient, so they will be claim on the medical legal cases. But make sure you have to be signed into the consent form, or other any kind of harm it will be occur on the patient. So on that time there is have some principle, there is some committee, so you have asked them and protect ourselves from their any medical legal cases. Next is to be autonomy. These are the people in vulnerable situation who may not be in their right state or mind, who have also may not have attained a legal age and competence. Example of these categories is a person are infants and children. respecting the principle of autonomy obliges and position to disclosure medical information and the treatment option that are necessary for the patient to exercise self-determination and support informed consent, truth-telling, and confidentiality. So you have to be before starting any treatment procedure. So you have to be totally ask the treatment procedure over the patient, and you have to sign over the consent form. If there is a condition of two, patient have incomparative or unconscious, so you have to be asked for their parents or their guardian or also their attendant, and also the children. There is no any kind of take a decision of their voluntariness, so you have to be asked about their guardian. So there is a autonomy of their voluntariness, choosing either the treatment protocol is beneficial or not, so it will be choose by their patient on self. Next is to be justice, a fair, equitable, and appropriate treatment to the person of the several categories of the justice. The one of the most perinatal or clinical ethics is to be distribute justice and equal share, according to the need, according to the effort, according to the contribution, according to the merit, according to the free market exchange. Fairness in the patient assumes to the role and primary importance when there is a conflict of intervention. So justice is to me the you have to share such information in a good manner, either it will be beneficial for treatment procedure or not. You have share such alternatives option and a plan B if there is patient have to be afraid about their electronic devices and manipulation therapies. You have to share like treatment procedure. I not think about that either it will be rich or poor. You have to not biasness with the gender or religion, and also the you have to be according the free market exchange also have there. So there is a justice will be there, and fairness the treatment procedure over the patient it will become an handicap. So you have to be primary role to treat or into the primary manner or the patient if they're handicapped, and it will be reached into the first priority over there. So that is the justice of the patient. So there is have to be a principle of biomedical ethics. So you have right university examination. Thank you.